I mean, prior to Omicron, we had peaked in the 20s. So being in the 30s and being in the 30s consistently is definitely a high number for us.
Children's Mercy Hospital continues to see COVID cases even as its staff battles the virus too. A battle that means fewer healthcare workers are on the job. I'm John Holt.
I'm Christelle Bell. As of today, Children's Mercy has 314 staff members confirmed positive for COVID. They're isolating at home. Fox 4's Jacob Kittelstad joins us now live from the hospital, where now they're asking recently retired healthcare workers to return. Jacob?
Yes, Christelle, specifically, they're looking for pediatric nurses and respiratory therapists as the volume of COVID patients has increased.
Almost all the people that are requiring hospitalization at this point.
The press conferences used to be held in person.
The data coming out about Omicron.
But now it's gone virtual as the Omicron variant pushes patient numbers upwards and staffing numbers downwards.
We have a lot of employees that are out with COVID-19. A lot of our nursing staff.
We are seeing an increase in younger children being hospitalized compared to earlier in the pandemic. I think a little over half were under 5 in this past week.
In general, those hospitalizations are getting shorter, a good thing. But the number of kids in the hospital is at a near record high. Doctors say the return of required masking is a good thing for schools in our area, a warning to parents who'd rather do nothing, perhaps preferring a natural immunity for their children over a vaccine.
A lot of people throw around natural immunity and they think that natural immunity is always better than vaccine immunity. And that just isn't true. And that is because getting vaccinated primes the different types of cells in your lymph nodes, so the T cells, the B cells, to differentiate. And when they differentiate, they develop antibodies that are more broadly protective than just against the spike protein.
And Children's Hospital has continued their policy of having employees who test positive isolate for 10 days, saying that other hospitals who have dropped their isolation time to 5 days based on new CDC recommendation and guidelines are basing that decision on information that predated the rise of the Omicron variant. John and Christelle.